We're talking with Marilyn Stanley. And Marilyn, you began having problems 4 or 5 years ago. What were those problems like?
They were very inconvenient for my lifestyle. I'm a very active person, incontinence. And,
so you're having incontinence when you were active, when you would cough and when you would laugh,
yes,
and that sort of situation?
Exercise.
And did you know that it could be fixed?
Yes, but it was a surgery I really wasn't interested in having at the time.
Yeah, because let's put it off until tomorrow.
As long as I could, right.
What was the straw that broke the camel's back that made you say, I'm going to have to get something done?
Well, I actually felt a bulge in the pelvic area.
Was that a prolapse? That
yes.
And you could feel that?
Yes, I could.
Then you had to say, oh,
I know,
something's...
It really scared me.
Its time has come. I bet
yes.
that would be very, very frightening.
Yes, it was.
What kind of surgery did you have?
I had the graft. I had graft and a sling.
So graft and a sling.
Mm-hmm.
And after surgery, let's say after a month or 6 weeks after surgery, could you tell the difference with your incontinence and with your prolapse?
I could tell the difference with the incontinence immediately.
So right away, laughter and running and doing work?
Well, I didn't run for about 6 or 8 weeks after the surgery.
Well, you've kept yourself in wonderful shape.
Well,
you do some type of exercise.
I do. I dance.
So your attitude toward the future as far as the surgery goes, you should do well for a long, long time?
Oh, absolutely. I think for life.
And the changes that it's made in your social life and your life at home?
Oh my goodness, it's wonderful. My husband and I can go on a trip and not have to stop at every single Cracker Barrel and rest stop.
Cracker Barrels are good for that, aren't they?
Yes.
You know, with that in mind, your advice for other people that have women with urinary incontinence and feel a bulge would be what?
Oh, to definitely get to a specialist as soon as possible. Really, because the longer you wait, the more difficult the surgery.
I think your teaching is wonderful. Marilyn Stanley, thank you for coming to the Dr. Bob Show and talking to us about the problem that you had and how it was solved and how happy you are now.
Yes, thank you for inviting me.